Hello, this week we're going to be talking about a leg length discrepancy, or a difference in the length of each of our legs. We're going to talk about a few potential problems that can cause and a very simple fix. But first, our disclaimer. Mike Matthews, physical therapist here with the PT 411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter. Also, make sure you check out thept411.com so you can be notified when I come out with new content. So like I said, this week we're talking about a leg length discrepancy. Last week we talked about one of the issues that this can cause, our lateral shift in our lumbar spine and our lower back, that can usually cause pain on one side of the back. Usually it's going to cause leg pains as well. And the reason why it's causing this issue, one leg that's longer than the other one, it's going to offset our hips. I have a leg length discrepancy myself. My right leg is a little longer than my left one. So if I put my fingers on the same spot on my pelvis here, you're going to notice that my right side is up a little higher than my left side over here. That's going to offset my hips automatically. My right side is elevated a little bit. It's going to compress my spine a little bit on this side compared to this side. It's not a lot, but that's definitely enough over time to move everything from that compressed side over to the opened up side. Everything's going to just shift over there over time. And what ends up happening, an obstruction develops on this side and it starts to push me over more and more this way. It starts to cause lots of issues there. I went into a lot of depth with that issue last week and how we can fix that, so make sure you check out that video there. Our second issue is happening more at the hips. It creates a muscle imbalance down here. My longer side is not going to have to work near as hard as my left side to advance forward. Whenever my right side is planted, since it's longer here, I don't have to hike up that opposite hip using these right hip muscles. So now, whenever I'm advancing forward with this left side, I don't have to elevate over there like I said. So I can just come forward. I'm not utilizing these muscles. I'm not having to use them that much. But whenever I'm planted with my left side, with my shorter side, it has to work harder. I have to engage all these muscles, especially that gluteus medius muscle over here, to elevate that opposite hip quite a bit more, because this side's longer. I have to elevate it quite a bit more in order to be able to advance it forward, to be able to clear the ground. Another issue that can happen is I can overwork these hamstrings too. I have to bend that knee quite a bit more on that right side to be able to advance as well. The very first video I did on this channel was about the gluteus medius and how to strengthen that up, so make sure you check out that video as well. So our third issue that we're having here is actually down at the ankle. Whenever we have this issue, we're going to compensate sometimes down at that ankle as well. We're going to lose that arch. So we're going to take a closer look here. Now sometimes the longer side, right side in my case, is going to try to functionally shorten in order to even out everything up higher. There's not a lot of places that we can shorten it. Yeah, sometimes we can try to bend the knee a little bit. That can lead to some knee stiffness and issues over time. But the most common place that this is going to occur at is at the ankle and foot. So if I stand up nice and tall, if you watch closely, if I'm nice and lazy, I lose my arch on that right side. It might not seem like a lot, but what ends up happening is if I lose that arch over there, if I put my thumbs in the same spot over here on my ankles, if I lose this arch over here, it drops it down considerably. I'm going to lose stability in this foot here and in this ankle. It's going to lead to a whole bunch of different issues. I'm going to start out toeing whenever I'm walking to compensate for that loss there. My big toe is going to take a lot of force. I'm going to lose a lot of mobility in that big toe because I'm not utilizing it forward. Now I'm rotating sideways every time I'm walking. It's going to put a lot of pressure on my knee, put pressure on my hip and on my back as well. And the end result is my body still develops issues to all those body parts it tried to avoid having issues with by doing that compensation down at the ankle. So I'm off no better by developing this compensation, and I might actually end up being worse here. So how do we fix this? First thing we got to do is we have to determine if we actually do have a leg length discrepancy. So we're going to have to take some measurements here. And you're gonna need a marker, a tape measure, and a second person to help you measure this. First thing you're gonna do is mark your spots. Now this first point is gonna be up at your pelvis here. You're gonna take your thumb across your iliac crest, this upper part right here, the upper border of your pelvis. You're gonna follow that down forward until right before it drops off, you're gonna find a point right here. Take your marker, you're gonna go directly right on that point. You're gonna put your dot right there. You're gonna make sure that you're gonna find the exact same spot on the other side and put that there. The second point is gonna be down at our ankles. We're gonna make a mark at the bottom of our medial malleolus here. We have two bones right here on either side, our ankle bones. Actually, it's part of our tibia on this side and our fibula over here. So we're gonna bring it to the side right here to show you where we are. We're gonna put our line right at the bottom there. We don't wanna go too low or too high, but you're gonna take your finger there and feel right where that bone ends. You're just gonna make that mark, a little line at the bottom right there. Make sure you also do it on the other side there. And this is where the partner and the tape measure comes in. You're gonna lay down on the ground, nice firm surface. You're gonna start off with your knees bent. You're gonna pick your hips up, bridge up, and do that a couple of times. Reset everything in your hips and your lower back. You're gonna straighten out both those legs there. Your partner is going to take the tape measure. They're going to start up at the top, and you can hold it for them. You just want to make sure after you bridge and you bring those legs down, you're being pretty still there. So you can hold it there, and they're going to take that tape measure and take it all the way down to that other line. You're going to look at the centimeter side, and I'll tell you why here in a second, but you're going to measure each side, make sure you're measuring them the exact same so that you make sure that you're not going to cause any errors and you're not going to get any false readings there, but you're going to take that and you're going to measure that. So the next thing we need to do here is compare. So we've determined that difference there. Mine will take me for an example, 1.2 centimeter difference. My right side's a little bit longer than my left side. So what do we do with this information here? We're going to get a heel lift to fix this issue. Right here, I've got mine. It's not 1.2 centimeter difference. I've got a 0.8 centimeter difference. You always want to go slightly less than what you have, because if you try to correct it fully, your body's already somewhat used to this, and there are some compensations and other issues that we don't want to fully correct, because then it's actually going to overcorrect things to the other side. So you're going to go slightly less, not a lot less, but slightly less there. And I'm going to show you what a difference this makes here. But before I put this underneath this left side, since this is the shorter side to elevate it, I'm going to show you just standing, freestanding here, what ends up happening. My foot on that right side collapses in to fix that issue. But if I take this and I put this under that other side, and then now I try to freestand, now I'm actually having to elevate. I'm actually elevating this side, bringing it up just so I can even it back out here, because if I collapse down now I have an issue in the opposite direction. So it automatically fixes it there. Now there's lots of different brands out there. I'm not going to be too specific on what to get. I haven't seen a pair that I did not like. I use these. They're easy access for me as a physical therapist. These are Vasily and Dannenberg's. They work pretty well. There's lots of other brands, like I said, that work equally as well, though. I'm not here to make any money off of any of these. I'm not in any way affiliated with Vasily and Dannenberg. It's just the ones that I prefer. Now when you take these, the big thing you got to do is you got to get your shoe. You're going to put this underneath here. These ones have adhesive on the one side. I've lost a little bit of stickiness because I took it out of this shoe. But what you're going to do is you're going to get your sole, you're going to elevate it. You're going to put this underneath, and you want to put it, wedge it all the way to the back of the shoe right there. And then you're going to put that back over it. If you are only getting one of these, but you like to switch out your shoes, don't take the adhesive off, just put it in there so you can switch it out back and forth so you don't have to buy 1,000 pairs. There you go. That's going to fix that issue. That's going to minimize the possibility of this leg length discrepancy to cause these other issues. But when I said issue, I kind of misspoke. This is not an issue in and of itself. Asymmetry, having one side longer than the other, a difference from one side to the other, is actually very normal. You're never going to find somebody that's perfectly symmetrical on both sides. One arm's typically going to be slightly longer than the other. One leg might be a little different than the other. Your hips might be shaped a little bit different from one side to the other. Ribs, everything's going to be a little off, a little different. So if you're not having a problem, you're not having an issue, but you notice that you have something over on one side that's not on the other, anywhere from head to toe, I'm not here telling you that you have a problem, that there is an issue just because there's an asymmetry in your body. Asymmetry is completely normal, but sometimes, like this leg length discrepancy, this very normal occurrence can potentially cause other problems. So we want to fix these when we see this issue, especially if you're having ankle problems, you're having back problems on one side, or you feel like you have a muscle imbalance in your hips. It's a good idea to go ahead and just take a look at this to see if this potentially might be causing your problem. Now, like I said earlier in this video, I did make a couple other videos, one for that lateral shift in that lumbar spine and that gluteus medius weakness, so make sure you check out those videos there. I have not done a video for our ankle if we're collapsing that arch yet. I'm planning on doing that video next week, so make sure you stay tuned for that one. Again, I'm Mike Matthews, physical therapist with the PT411. Make sure you follow, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter, and check out my website, thept411.com. Thanks for joining me.